McGee. My name is Skylar Chappell, an advanced practice nursing student.
Hello.
Can you tell me your name and birthday?
Jenna McGee, 12/5/97.
Awesome. So what brings you in today?
I'm just here for my yearly checkup.
Okay. Well, do you care if I start out with some medical questions?
No, go ahead.
Okay. So, do you have any allergies to medications?
No.
What about food allergies?
No.
Environmental allergies?
No.
Do you take any medications currently?
I do not.
Even over the counter, you don't take any?
I take a prenatal vitamin.
Prenatal? Okay. Do you know the dose on that?
No, because it's got like folic acid and all of the different ones.
Just one tablet
yeah,
though?
just one tablet a day.
You take it once a day?
Yes.
Awesome. Okay, and you're pretty regular with that?
Yes.
Okay. What about immunizations? Are you pretty much up to date with those?
Yes.
Okay. Any past surgeries?
Yes, I had surgery on my wrist in 2012, and I had wisdom tooth surgery in 2017.
Oh, what was the wrist surgery for?
I had a cyst in my wrist.
Okay. And then previous hospitalizations?
I've never been hospitalized, no.
Okay. Chronic illnesses?
No chronic illnesses.
What about injuries?
I've broken my wrist before, and that was when I was in the 5th grade, and I also broke my tailbone when I was in middle school.
Do you have any long-term deficits from that wrist?
No.
Okay. What about childhood illnesses?
No.
When you were born, did you have a traumatic birth that you can think of?
No.
Okay. What about, have you ever been pregnant?
I had not.
Okay. What was your last menstrual period?
2 weeks ago.
Okay. Are you pretty regular?
Yes.
Mental health, how would you describe your mental health?
It's good. I used to take some anxiety medicine, but I no longer take any medication for it. I've been able to cope with it pretty well.
Lifestyle modifications.
Yes.
Awesome. Okay. What about transfusions? Have you ever had a blood transfusion?
I have not.
And then health screenings. Can you think of any?
It was a year ago.
A year ago.
Yeah.
Okay. Awesome. Family history. So, your mother's side, do you have any? Does she have any history?
She had thyroid cancer, so she had to have her thyroid removed.
Okay.
My father has hypertension, and my grandfather on my mother's side has diabetes. And
Any siblings? Did you?
no, my sister does not have any
Okay.
medical
Awesome.
conditions.
Where do you work at?
I'm a nurse at a hospital.
Okay, and then as far as like chemical exposure, do you wear all your PPE if you ever exposed to
Yes.
chemicals? Okay, awesome. Education?
I have my bachelor's degree.
Are you married?
I am.
Any tobacco use?
No.
What about alcohol?
Well, I guess I would probably 1 to 2 drinks a week, maybe.
Okay.
Or every 2 weeks, sorry.
Okay. Any drug use?
No.
Illicit?
No.
Okay. How would you describe your spirituality and culture?
I am a Christian, and I don't have any cultural practices.
Okay. Environmental influences that you can think of that would?
No, I live at home, in a home by myself, so.
Okay.
Or with my husband.
Do you eat pretty well?
Yes, I would say so.
You do? Okay. Do you eat all 3 meals a day, or do you snack a lot, or
Sometimes I skip breakfast occasionally, so.
do you say your appetite's pretty good?
Yes.
Okay. In fitness, do you work out?
I try to at least 3 times a week.
And how's your sleep schedule?
It's good. I usually am able to sleep through the night. I sometimes nap during the day, though.
Do you? Okay. Let's see. Concerns about cost of care. Like, do you have problems avoiding your medicine?
No, I have insurance.
Okay. And then, have you traveled recently out of the country?
No.
And then, due to privacy issues, I'm not gonna ask about sexual activity, but normally I would ask about that, how many partners the person had, their protection method, and then if they're on birth control or not. Okay, so that was that. Any questions?
Not
Okay,
so far.
I'm gonna take your vital signs to start off with. So, to take the blood pressure, I would locate the brachial artery, and then I would use a small cuff on her, and I'll put about 2.5 centimeters above the brachial artery, and then I would inflate the cuff until I could hear the diastolic and systolic pressures and note those. Also for the radial pulse, I would palpate that for 15 seconds because she's irregular, and then multiply that by 4, and that's like a 2+. And then for respirations, I would watch her chest rise and fall for 1 whole minute to get that. Okay, so I'm gonna start out by looking at your scalp. I'm looking in 3 different places. So I don't see any redness, I don't see any lesions, I didn't see abnormal moles or of any sort, didn't see any rashes either. So I'm gonna move down to your facial symmetry. So her face is nice and symmetrical. I don't see any abnormalities with her skin. It looks appropriate the rest of her skin tone, no moles that I can see. In her ear. Do you mind turning to the side for me? So for that external ear, I don't see, it looks like it's anatomically correct. I'm gonna just put pressure on this tragus. Let me know if it's tender.
No.
No? Okay, awesome. I'm gonna get my otoscope out. Okay. So since she's an adult, I'm gonna pull her pinna up and back. Okay, I don't see any redness. I don't see any inflammation. I note the tympanic membrane is nice and translucent, there's a cone of light, and the malleus is identifiable. Okay. Actually, while I go ahead and have this out, I'm gonna go ahead and look at your nose as well. So, if you don't care, just to look up for me, I'm gonna look to see the turbines and the septum. Septum looks midline, I don't see any inflammation or redness. As far as your eyes, I'm looking at the exterior. Her pupils are nice and round and symmetrical. I would say they're about a 3 in size. Her iris is brown in color. Do you mind? I'm just going to pull down on your eyelid there. Okay, look up. Okay, and then look down. Her conjunctiva is nice and white. Her sclera was not yellow or abnormal in color. I didn't see anything in her eyes. Her eyelashes, they're nice and full. Her lacrimal gland was identifiable. And then let's see if there's anything else. Okay, now what I'm gonna do is I'm just gonna have her look at this chart. So I'm just gonna have you read I'm gonna hold this about 14 inches from yourself and have you read the line, the lowest line you can.
Okay. 3, 4, 7, 2, 5, 8.
Okay, so she can read at 20/20 vision, so it means at 20 feet. She can read at 20 feet when other people can read typically at 20 feet. Awesome. Okay, so I'm just gonna take a look at your eye. So I'm gonna change this out because I want to use any news. Okay, just look at me if you don't care. And I'm just gonna look for constriction bilaterally. This light. Okay, awesome. Both eyes were able to constrict bilaterally. Let's see what else. Okay, I'm gonna have you look at my finger if you don't care. Okay, so she's able to look at that. And then I'm gonna have you look at this back wall and then back at my finger and then back at the back wall. So she accommodated appropriately. And then I'm gonna have you look at my finger and just follow my finger with your eyes. Do not move your head, okay? So cranium of 3, 4, and 6 are all intact. Also, I was able to, with using the snail chart, I was able to use, her optic nerve was also intact. And then normally I would have a piece of peppermint or coffee grounds just to have her smell to see if she can identify the smell appropriately, to see if her olfactory nerve is intact. Okay, so moving down, so your smile, you keep your smile for me, and then frown, and puff up those cheeks, and then move your tongue side to side, clench down for me. Okay, and then open big. And then I'm just gonna pull down your gum just to see. Nice and pink, I don't see any ulcerations or lesions. And then lift up your tongue. Okay, and then you can just relax your tongue. And then open big and wide for me. And say, ah. Ah. Okay, and I can see both the heart and soft palate back there. Everything looks nice and pink and moist. Like I said, no lesions. Okay, so now what I'm gonna do is I'm gonna go down to the lymph nodes. So with the lymph nodes, I'm going to feel the occipital, the preocular, postocular, tonsillar, supramandibular, submental, and then supraclavicular, anterior cervical, and then posterior cervical. Any tenderness there?
No.
Okay, awesome. And they were nice and movable, all of her lymph nodes were. And I'm going to do your sinuses. So I'm going to do the maxillary. Let me know if there's any tenderness there.
No.
No? Okay, good. So moving into your neck, what I'm going to have you do is I'm going to have you lift up on my hands. Okay, good. So that cranial nerve is intact. So also I'm going to do some range of motion in your neck. So I'm going to have you bend your neck down, look up, to your right, to your left, then back.
Oh, sorry.
No, you're fine. Okay, her range of motion was intact with her neck. Moving down to her posterior side. Do you mind if you turn to the side again for me? So, I'm going to go ahead and grab my stethoscope. So, looking at her back, normally I'd want to make sure her shirt was off and her front side was draped just to make sure you get a good visualization of her back. I would note her skin tone and color, make sure there's any moles I want to check out. So I'm just going to palpate. Any tenderness?
No.
Okay. I'm going to feel down her spinal processes. Any tenderness, let me know. None? Okay. So I'm going to just cause vertebral tenderness. So I'm going to put my hand right here and then just let me know if that's tender. Okay, ready? 1, 2, 3.
No. No.
Okay. And so now I'm going to watch her take a good breath in for me, and I'm going to see if it rises and falls equally. Okay. So my hands move symmetrically in and out. So let's see. I'm going to percuss now. So on the lung borders. Actually, I'm going to test for tactile firmitis. So whenever I put my hands on your back, just say the word 99 for me.
Okay. 99. 99. 99. 99.
Okay. And I'm going to percuss the lung sounds. So ready? And I would do this bilaterally. And now I'm going to auscultate in the same places that I percussed with my diaphragm. Take a deep breath in every time I put my stethoscope on your back, okay? I did not hear any adventitious lung sounds. It was nice and clear, and so I would do that also at auscultate on both sides normally. Okay, you can go ahead and turn around for me. So looking at her front of her chest, I'm just going to palpate. Normally, once again, I would drape the back side of her, be able to see the front side, get a good visualization of her skin. I would look at her skin color, her tone. I would look to see if there's any abnormal moles or lesions. I would also ask about breast changes if she's noted any, and then I also would palpate that. So I'm just going to feel it right now. Okay, any tenderness?
No.
Okay, so I did not see or hear any, or I did not see anything abnormal or feel anything abnormal. And then whenever I'm going to go ahead and look to see her trachea while I'm here as well. It's nice and midline. Okay, and then I'm going to palpate the thyroid from the back on both sides. Can you swallow for me? Okay, I did not feel any lumps or abnormal areas there. So going on to your chest, let's see. I'm going to, so I've already inspected, so I'm going to go ahead and I already palpated, so I'm going to go ahead and percuss. So her heart's on the left, so I'm just going to do. Okay, awesome. And then now I'm going to go ahead and listen. So I'm going to listen in the aortic valve, which is on the right side, second intercostal space. Take a deep breath. and over here on the second intercostal space for the pulmonic valve. Dropping down to the third intercostal space for that second pulmonic valve for the herbs. Dropping down into the third, or the fourth intercostal space for the tricuspid. And then for the mitral. Okay, I'm gonna go ahead and listen in the same spots with my my bell. I'm going to feel a vocal impulse, short and tapping. Okay, awesome. Okay, so I'm going to move to your belly. So if you don't mind, just go ahead and lay back for me. So I'm going to inspect to see if I have any pulsations, which I do see the aortic, and then I'm going to go ahead and look at the jugular. Do you mind to turn your head? Okay. Hold. Awesome. Okay. I do not see any pulsations for the jugular. When inspecting her abdomen, once again, just look at the skin tone. Her stomach appeared flat. Let's see. And then I'm going to percuss. So I'm going to percuss the liver border, and then I'm going to percuss the spleen edge as well. Okay, and then I'm going to go ahead and feel for that edge. Okay, take a deep breath in for me. I can feel the liver border, and so same thing with the spleen. And I can feel that splenic border as well on that side. And let's see, flat. When I am going to go ahead and auscultate first, so when I'm doing this, I'm going to be assessing the vowel sounds, and then I'll be listening for bruits as well. Vowel sounds are nice and active. Turn it down. Three for the aorta, the renal, and then the iliac. I'm also going ahead and listen to the jugular. Go ahead and take a deep breath for me. I did not hear a bruit in any of those areas. So I'm going to go ahead and palpate. So I'm going to go ahead and start in this corner. Let me know if you have any tenderness, okay? And it's just a light palpation. Any tenderness? Okay, I'm going to go a little bit deeper.
No.
About there. No? Okay. And it was nice and soft to the touch. If you don't care, just go ahead and sit back up for me. And I'm going to check range of motion of your arms. So I'm just going to have you hold your arms out and then go up and then behind your head and then behind your back. Good range of motion there. Any soreness or tenderness?
No.
Okay, I didn't hear any crepitus either. So I'm going to go ahead and identify the chromium process, the chromial clavicular joint, the head of the humerus. There. Okay. Any tenderness when I palpated there?
No.
Okay. And then going down into the arm. Now I'm going to range of motion right here. So if you don't care, just move your hand to the side, and then flex, and then extend. Okay, soreness there?
No.
Okay. And then I'm gonna go ahead, and I would do that normally bilaterally. So I'm gonna go ahead and go down. So on as far as her, I would normally listen for or feel for the femoral pulse, and then also for any swollen lymph nodes in her groin. And then for your hip, do you mind just to go ahead and lay back for me again?
Okay.
Okay. So I feel the iliac crest. I feel the head of the femur, and then the anterior and posterior iliac spine, and then the ischial tuberosity would be behind there. And I'm going to go ahead and do some range of motion with your leg. So I'm going to have you lift your leg up and then back down. I'm going to go ahead and go to abduction and adduction. Okay. And then any soreness there? It's okay. No. I didn't hear any crepitus either. Go ahead and sit back up for me. And I'm going to go ahead and look at the knee. So I feel the meniscus, medial and lateral femoral condyle, medial and lateral tibial plateau, and then I'm going to feel for these tendons. I feel both of the ligaments back here. Okay. And then, like I say, can you extend out for me and then flex? Okay, and then going down to the feet, I'm going to look to see, feel each one of the joints. I don't feel any crepitus or any step offs or anything. Her nail beds, I might be able to check if she's nail polish, but normally I would look to see if her bed was blanchable, and then also her color looks great. Her feet are nice and warm. I'm gonna go ahead and do posterior tibial pulse, 2+, and then dorsalis pedis, and that's about a 2+. And then go ahead, and if you don't care, just lift that foot up, and then put it down, and then side to side. Okay, great. And then your hands, do you mind if I look at those? So like, she also has nail polish on her fingers, but normally I would just check to see her cap refill. Her hands are nice and warm. Are you able to move your fingers? Okay, pronation, go ahead and do pronation, then supination. And then I'm gonna see if you can touch your thumb to each one of your fingers. And then move your hand like this. Okay. Touch your ulnar and radial. Okay, awesome. No crepitus or anything there as well. So let's see, and then now what I'm gonna do is go ahead and check for reflexes. So I'm gonna start right here at the facet. I'm just gonna go ahead and, if you don't care, I'm just gonna have you put it right here, okay? Okay, and I'm gonna move down. Okay. Go ahead and relax your arm. And then I'm gonna check to see her patellar, so relax that for me. Okay, awesome. And I'm gonna check Achilles. And then I'm gonna check the Lewinsky reflex. So I'm gonna have you lift up your foot for me if you don't care. And I'm gonna curve. Okay, awesome. She responded to that. And so I'm gonna get a cotton swab out. Sorry. You're fine. So this is gonna be soft. Okay, did you feel that?
Yes.
And then this is gonna be the sharp object. So I'm gonna have you, whenever I touch various places in your body, tell me if it was soft or sharp, okay?
Soft. Sharp. Soft. Sharp.
Awesome. Okay. Okay, do you care to go ahead and stand up for me? Okay, I'm just gonna have you take some few steps forward.
Okay.
And then I'm gonna have you go back, and I'm gonna have you put your toes to toes to heel. Awesome. Okay. And then I'm gonna have you bend down, and then lean backwards, and then go to the side, and go to your other side. And I'm going to have you stand right here, can your arms out. I'm gonna push against you, and you just pull up on it.
Okay.
Awesome. And then same thing here, pull down. Okay. Awesome. And then put your hands up like this. Okay. I'm gonna push against me, and I'm gonna pull. Awesome. And then once again, launch you out, and then I'm going to push against you, and you just try to resist me. Okay, close your eyes and stand forward. I know she looks like she can, her gait's intact. She's able to hold herself up. I don't notice any significant swaying, or she's not falling over. So she passed that. Do you have any questions for me?
I do not.
Okay, well, it was a pleasure meeting you.
Thank you.
You're welcome.